Hey guys, it's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering days versus nights. If you're a brand new tech starting out, which one should you do? The pros and cons for the emergency room. So to give you context, I am a night shift Xray tech, been doing it for over 4 years. Work ungodly amount of overtime, both days and nights, so I have a pretty good knowledge as far as, both sides. So, to give you more context, the clinical site where I went as a student was one of the same places I am currently working at since the very beginning. So I had a pretty large amount of knowledge prior to getting my job, right? So, I will say if you're a brand new tech, maybe you didn't go to this hospital, to the emergency room, wherever it is. It may be a little bit intimidating because it's a new place. You've never been. You have a general idea since you're not certified as a tech, but you're still, I never went to this hospital. So, essentially, in the shortest term possible, going on the day shift, if you're brand new, might be the most safest option, just due to there being most places, veteran techs, the ones who work like the 9 to 5, who's been there the longest, usually end up in day shift, the seniority shifts, the only Monday through Friday type of shifts. And most of those techs work in the daytime. So if you're a brand new tech and you're still trying to learn, if something goes wrong or you don't know how to do something, usually someone in the daytime can kind of help you out, because during the daytime you have more Xray techs at your hospital versus at the nighttime. Depending on how your situation is, sometimes it's just you. Sometimes there's 2 techs. And I've seen, I think of the traumas 2. I'm in a trauma 3. At a trauma 2 ER, I believe there's 4 techs. I can't remember what some of my people said at work, but there's a little bit more. But, the higher trauma, the more action, the more busy and stuff it gets. So I would recommend anyone going to the daytime if you're still new and you're kind of scared about, just trying to get your foot in. I didn't really have a choice as far as full-time employment at my job, because that's all they had open was the night shift. And as someone who is not a night owl, as they call it, who is a daytime person, I'll be asleep by 9 p.m. My lady will get mad that I sleep early unless I'm getting paid monies. It was the best decision for me, now looking back at it, to work nighttime for me, just with the kids and everything going on. And I wasn't as intimidating going to work not knowing stuff, because I already had a large base knowledge of what it was. It was just learning all the tiny details that when you're a student, maybe they don't teach you, or you don't pay attention to certain stuff as much. All the behind the scenes little computer stuff, and dealing with the other departments or the protocols and stuff like that. So within probably, I want to say 3 months, by the 3rd month, I felt very confident and everything was pretty smooth. And then probably by, I want to say a year doing it, I already kind of knew majority of everything that could happen, both if you mess up, how to fix it, and as far as random things happening at work, with the network, with the system, you already got a good amount of information to know how to fix it. Because at nighttime, you don't have upper management. You're alone. And depending on who you work with, let's say you have a partner, like their knowledge is only so much. And majority of the times what we end up doing is we try to figure it out. If we don't know, like at our hospital we have different branches, we try to reach out to like maybe like the closest other branch of our hospital to see if maybe they're dealing with the same stuff or they know how to fix it before we have to wake up our manager. Because majority of the times we try not to wake up the upper management unless it's absolutely necessary. Oh, we don't know what to do. So that's a little bit different, because in the daytime you could just call the extension and then, or just text your manager, and it's a little bit different dynamics. Same thing with like the workflow. It is technically larger workflow during the daytime, but there are more techs, and depending on how the characters that work, or as I call them, the other people are, it could be good, it could be bad, depending on how you are. Me personally, I'm antisocial. I really don't talk too much. So even when I do work daytime, it does drain you, because everyone's all chipper and all happy and all talkative and doing all this. So as someone who's antisocial, it is a little bit draining, but you know what? For extra money, I'll do it. It doesn't bother me at all. But that is a different dynamics. And let's go. We got the good doctor tonight. That's what I'm talking about. The good doctor has been here. We've been blessed by Jesus 6 nights in a row. That's what I'm talking about. I'm already excited. I know if you're watching this video and you're like new to working, ain't nothing but a good doctor. You get you a good doctor at night, you already know you're gonna be chilling. You're gonna be chilling. It's gonna be a smooth night, regardless of what they bring in. It's gonna be a good night. Just putting that out there. At daytime, I don't know. To this day in daytime, I'll let you know, there's never been a good day. As far as like we've just been chilling, that don't exist. I'll let you know that already. There's always something going on. It's busy. You got stuff like, you got stuff flowing, stuff floors, post-op, a bunch of like surgeries. So there's a continuous level of like workflow going on. Over here at night, the only surgeries that are happening that you deal with is the post-op, or anyone who comes through the emergency room and they get like messed up really bad, then they gotta do like some emergency surgery. Or you deal with it a little bit like around 5 to 6 in the morning, which that's kind of when they open up the surgery joint for the regular like morning crew. You'll deal with them there. As far as pay wise, if you work in the daytime, you'll make less money, obviously. I would say it's like, I think ours is like $3-4 difference between pay, if that's something that affects you. Same thing if you burn PTO. Our PTO, like I try not to burn that much PTO, because if I go on vacation, right? Let's say I worked daytime, right? Hypothetically, the PTO I would burn, I would end up getting the same level of check, because in daytime, if you work the evening shift, it's a little bit different because you still have a shift diff. But if you work just like the Monday through Friday, the 9 to 5, whatever, and you burn your PTO and you go on vacation, your check would be the same. With mine, because of all the shift diff and, you know, the way I work 7 on, 7 off, and the weekend pay and all that, it's probably a good $600 difference when I go on vacation and I get PTO check. Like, and for some people, 600 difference is not that much. To other people, like that could literally be a car payment, and it could, you know, that's a good amount of money that is, you know, used. Just putting that out there. Well, what else? During the daytime, especially if you're still trying to learn the system, majority of the times the system doesn't go down during the daytime, unless they're doing they're changing systems. Like at the nighttime, I would say about twice a month, the network will go down. Either the PAX / which Epic, which everyone uses, will always go down for maintenance or whatever, and you'll deal with putting stuff manually and dealing with other, systems like the like how to input stuff and how to deal with that, and dealing with the online radiologists. That's when we see them during the night, at least at our place. So it is a little bit different dynamic, and I could see if you're starting off and like it could be something that would be kind of like the worst thing. I would feel like if I didn't go to this hospital as a student, would be not knowing and not being able to keep up with the pace of the other techs, because I would mess up all the time because I couldn't, just because of the knowledge you don't have yet. And like thankfully, like as soon as I came in and I got employed, like I was able to transition, and within a tiny time frame, I was already, at a pretty decent level of pacing and knowledge, because ain't nothing make you more mad than someone kind of being like the weak link, and it affects the workflow at night. As long as you have your other partner who does, like in my case, as long as you can do a chest x-ray, that's good enough for me. We can make it work. Everything else, like I already have a good amount of knowledge. Worst case, you just ask me, hey Miguel, I don't want to mess up this. What can we do? And I'll be like, all right, cool. Because at daytime, if it gets too full and too pacing, and slowly the work falls on certain techs more, by the end of the shift, you will literally feel it. There's been times where I work with certain techs that are newer, or they're just not the most, I wouldn't say lazy, but they'll like talk a lot, and the workflow won't be distributed as easy, or they'll only cherry pick exams, only do the easy ones and the more harder patients, and you'll slowly feel it over the shift. And at night, regardless of what comes in, there's only two of us. Either we're split up around the hospital doing stuff, and everyone's just kind of like the workflow gets carried pretty equally. And if like there's a like it's more of a teamwork type of thing. Even with the other departments, it's more team friendly. Like in the emergency room, everyone tries to get along. In daytime, majority of the times, even within your own team, it's not a team. Like you'll try to go into a room, and nurses will basically tell you to leave, to come back, and they won't let you like squeeze in as much, or they'll get mad because they run the little protocol of the emergency room a little bit different than it is at night. At night, most nurses are pretty chill, and it's a way different dynamic. So hope that helps someone make their decision and you're better educated. But I will say, I still preferred like nighttime. I was still thankful that I was able to be kind of pushed into nights, because I don't regret it. I love it. Like right now, the good doctor, I already know for a fact, he's gonna follow the Alara protocol, and we're gonna be chilling for the night. And even if he does order a bunch of stuff, I know for a fact that patient probably needs it. And I don't even get mad at the doctor for ordering, because when you have a good doctor and he's nice, and and he doesn't order that much, or like there's easy to talk to, it doesn't bother you. Because we have certain doctors that they'll order a bunch of unnecessary stuff and be complaining, and it's like hard to communicate, or even kind of like, and it will piss you off. Ain't nothing worse than seeing one patient come in with like, it looks like a skeletal survey almost, and then you're like, half of this isn't necessary because you already CAT scanned them, and there's like extra radiation. And then like with our doctor right here, the good one, if a trauma comes in, majority of the times, if they're like severe, majority of the times he'll just end up just CAT scanning them, and then maybe he'll throw in the chest for like pre-op, or If something's like super deformity, he may have us go in there and just X-ray the one part, and like it makes the job way easier for everyone. So, but yeah, it's been your boy Miguel. We'll see you on the next one.